Hey everyone, it's Dr. Charlie Johnson, physical therapist. In this video, I want to share with you a new perspective, a new way of looking at how you can resolve these chronic back, butt, and sciatica problems. So this video is perfect for you if you've had or been suffering with some type of, back, hip, buttock, sciatic type problem. Chances are you've gone everywhere. You've tried many different things trying to solve this mystery, right? And you've invested a ton of time, energy, and money to do so. So I want to let you in on a new sort of pain paradigm, a new approach, a new way of solving this, and something you really want to consider if you're stuck spinning your wheels in chronic pain. So in case you're new to this channel, again, my name is Dr. Charlie Johnson. I am a physical therapist and orthopedic specialist. And essentially what I do is I empower people, I teach people, I give people the tools, knowledge, and understanding to solve their own pain problems. This way, you don't have to rely on someone else to do it. And you don't need things like pills, shots, or surgery, which I'm not saying they never work. I'm just saying for a lot of people, they don't. So that being said, I teach people how to heal naturally using movement as well as other mindset-based strategies as medicine. And today I want to share with you sort of one different angle or different approach if you've been suffering with chronic pain. All right, so again, this is perfect for you if you've been dealing with chronic back, butt, sciatica problems, trying everything to get out of it. Chances are you're stuck in a fight or flight phase, that sort of state of the body that occurs when you're in the dark alley and somebody runs up to you and you've got to decide, do you fight or do you flee, right? Or if you're in nature and there's a bear chasing you, you're not thinking about digesting your food and other things. You're thinking about just surviving, right? So pain can often do this to us. So a couple questions here, right? Are you stuck in a fight or flight state? Are you trying to bypass or bulldoze through your pain, right? You're one of those people who has a bulldozer type personality, like kind of suck it up and we'll push through it. Are you being kind to yourself or trying to push through the pains in hopes it will go away? Here's the truth. If you're in chronic pain, the more you try to control this thing by fighting it, by bulldozing through your pain, or the opposite, trying to flee from it, running from it, the more you fuel it. So I know it sounds counterintuitive, but it's true. So realize that pain is just a danger signal. And it's a great preoccupier. It can be all consuming. So a lot of people I chat with say, Charlie, I think of this thing all the time, right? And therein lies the problem. So the more you try to fight or flee from your pain, the more evidence you give to your brain and your body that it's dangerous, right? If something wasn't dangerous, there's no reason that you would fight it or run from it. You would just kind of wave to it, right? So by trying to control it, you give it more attention. The more attention you give it, the more of a problem or threat it becomes. A problem is only a problem if you make it a problem, right? Now, we'll talk about that so you don't give me a virtual punch through the screen, right? But the idea is this: fear fuels pain. And it might not be fear, it might be frustration, it might be worry, it might be concern, anxiety, something like that. Attention reinforces the pain experience and your pain persists, right? So if you ever asked yourself, or said to yourself, oh man, if I wear this type of shoe, then I'm hoping it doesn't make my back hurt more, or, oh my gosh, I have to go on this trip and I'm hoping they have these comfy chairs there because if not, I'm never going to be able to make it. Like all of this stuff, right? Every time we direct our attention and our mind to it, we make it more of a problem. And the more of a problem or threat it becomes. Okay, so it's a negative reinforcement loop and pain persists, right? So once we can remove our fear and remove the reinforcement, we starve pain of its fuel source and eventually it dies out. So I'm not saying ignore your pain. Pain is not the problem, is what I'm saying. It's the stories, attentions, beliefs, and reactions to the pain that either keep you trapped or allow you to move on. If you think about it, right, pain is not the problem. Well, Charlie, it hurts really bad. It is the problem. But you've probably had other times in life where you've hurt and it hasn't persisted this long, right? If you break a bone, it persists for 2 to 3 months and then it's healed and you get back to living life. Give yourself a bad paper cut, right? Then that paper cut goes away pretty darn quickly. So pain is an experience, as we'll talk about here in a moment. And the experience has become something that has sort of kept you trapped in, again, this negative pain experience or this negative feedback loop. Okay, so this is the idea. Look, the next time you experience pain, instead of trying to bulldoze through it or fight with it, right? Or control your pain, I want you to simply just recognize it for what it is. It's just an unpleasant, and yes, of course, it's unwanted sensation, but rather than trying to get it to go away, make it, do something to fend it off or do something to remove it from your body, right? Just tune into it and let it float by like it's a cloud and you're just watching it fly by, right? And you're not trying to make it go away. You're just letting it go, right? So my daughter, she loves Elsa from Frozen, right? So you just, think of that song, let it go, and you'll be okay. So why does pain persist? Well, pain equals damage. And this is the old diagnostic paradigm. You get this x-ray, you get this MRI, you probably had these if you're watching this video, and we're looking for something that's wrong, quote unquote wrong, right? Broken and or needs fixing. So the problem is this, the problem with this old paradigm is that we now know that all damage does not equal pain. So therefore pain does not equal damage. Sure, can it sometimes? Yeah, but in most cases it doesn't. Think about it. You break a bone, if you're in a terrible car accident, right? You'll get better after that 3 to 6 month mark. But then if you're watching this video, you've had pain for 6 months, 8 months, 12 months, 2 years, 4 years, 10 years, 20 years, right? Why is it that your body heals everything else, but it doesn't heal this? You have to start to question that. So realize that pain can be felt in the absence or presence of damage, something actually wrong with you or not. And it's an interaction between both the brain and the body. So your pain experience, right, is just a constant interaction or communication between your body and your brain. Body and your brain, it just goes back and forth. They're always sending messages to one another, right? And most people get stuck in what's happening or wrong with the body and go down a rabbit hole trying to fix it, right? There's a strict body focus or structural or mechanical focus. But your pain, is more than just a physical problem. It's a mind-body experience. And for folks who have been in pain for greater than, say, 4 to 6 months, it becomes a self-fulfilling negative feedback loop like we mentioned earlier, all right? And it looks like this. Right? So it starts when you move your body and something hurts. And then what does it tell your brain? Ooh, I don't know if I should do that. Right? And then you've got more negative input from the body in the sense that you start moving a little bit less to protect yourself. And then that continues to send threat to the brain. And again, you're stuck in this negative feedback loop. And we call this the pain fear cycle. So here it is. Movement hurts. Some type of fear, frustration, anxiety, concern, whatever. I'm afraid to move. Therefore, you move less. You have more fear, you have more pain, movement hurts more, right? And you just keep spinning around, spinning your wheels in this chronic pain and or pain fear cycle loop. And it results in pain catastrophizing. So if you have pain, you probably know what I'm talking about, right? You're a little bit anxious about that car ride, a little bit anxious about going to see that person, a little bit anxious about what the results of the image will show, whatever, okay? Worry, I wonder if I'll be able to do this. Fear, right? What the heck's going on? Could something be really bad that's going on? Is this a tumor? Is this whatever, right? Is there something else going on that I need to look into? And then that causes hypervigilance, right? Is this idea of like, I need to figure this out and become super hyper focused on it. And avoidance of things that hurt, right? You start moving less. And then it leads to disuse, depression for some people, right? As well as just discouragement, because again, this is another thing that just doesn't work, right? And then it feeds into your pain experience, and then you have more and more. If that didn't work, well, what else could it be, right? And you'll see here, though, there's this little caveat, there's this little spin-off, this sort of exit, if you will. And the idea is that if we can starve the pain experience of the fear, the anxiety, the worry, the things that kind of go into it, and we can confront it in a safe way, safe, progressive, and graded fashion, right? Then recovery happens. So it's not overnight, we'll talk about that, but it can happen. So all this does, all these negative inputs, right, is that it feeds the pain experience and keeps you trapped in it. So the idea is this, all you're trying to do, so reframe this from like something is wrong with me and it needs to be fixed. There's got to be something on and it needs to be fixed. Look, chances are, again, if you're watching this, you've had pain for any amount of time, you probably ruled those things out. And maybe they show stuff or maybe they don't. If you're somebody who this applies to, right, you've either been told you have everything wrong with you or nothing wrong with you. All right, so all you're trying to do and the way out of pain you're experiencing is to flip the current inputs from negative to positive, right? So the idea is that you have, you want to move in ways that feel good. And then it tells the brain, hey, I'm okay. You move more. I'm okay. You move more, right? So instead of thinking of doing exercises to fix a problem, just consider them as either negative or positive inputs. That's it. There's all these exercises. Which ones feel good and which ones don't? Start there. They either instill a sense of safety to your brain and body or a sense of threat. And one way into a sensitive, threatened nervous system is through the body. Rather than doing painful exercises that hurt so good or having a mentality of no pain, no gain, go easy on yourself. Find motions and activities that feel good and feel safe. Keep in mind, I'm not saying, right, to avoid painful motions or to be afraid of doing things, right, I'm not trying to perpetuate the pain fear cycle, but I am just saying, hey, why don't you just find things that feel good? Recognize that you feel unpleasant a lot of times and that there's a pain sensation there, but instead of letting it control you, why don't you just do what you can, right, and find things that feel good? You like walking? Cool. Well, walking hurts. Well, walk up to a certain point to where it doesn't hurt, or when you notice it, right? Can you tune in the sensations and are you able to sort of recognize them for what they are? Are you able to detach from them? Do they need to control you or not? Right? So find safety. And by finding doing motions that feel safe and improve how we're moving, this is what happens, right? So we've got positive inputs from the body, yummy motions, I call them. Wow, movement doesn't hurt. Therefore, I'm not so afraid. It's safe to move is what that tells my body or my brain. And therefore you move more. There's less fear, there's less pain, and you just start the cycle going in the positive direction. It's a positive feedback loop, all right? So using motion and exercise is one way to break the negative feedback loop and get things moving in a positive direction. Think about it. In the past, or at least most people I chatted with, have tried many, many things. And most of these things have caused more discomfort or haven't worked. So what does this tell you? If this happens enough, you begin to associate movement with pain, and life equals movement. So you just live less and less life. And, you used to be able to do all these things, and now your life, you can do these things. Now you can do these things. Before you know it, you can barely do anything. It's a vicious cycle, all right? So if you can find motions or inputs that improve how you move, then this breaks the cycle. And finally, begin to challenge the movement equals pain construct. So instead of going to PT or someone else and doing things that hurt and make you feel worse, you find things that makes you feel better. And you find ways to move your body that don't hurt. And in doing so, you send signals of safety associated with movement to your brain, and you kickstart things in a positive direction. You just need a place to start. It's hard to drive the car if you're not moving. As soon as you start moving, right, things free up. The other way to get the ball rolling towards relief is to change the way you view pain. This is on the brain side of the equation. By understanding that pain is a danger signal rather than damage per se, you open your mind to the possibility of healing because nothing's broken. Chances are, right, there are structural things that can cause pain. We've had chronic pain, and you agree that everything else in your life is healed within a reasonable time frame, but this hasn't. That's weird, right? And you have to say, hey, maybe there's something that's not wrong there. All right. So you either fuel pain by what you do with your brain and or what you do with your body, right? And I'm just talking about the brain here at this point. We talked about how you can move the body in good ways, right, to start to get things moving in the right direction. But the idea is this: by understanding that pain is a danger signal, right, rather than damage, you open your mind. And when you begin to break free from fear associated with pain, you quit reinforcing as something as dangerous. The more you do this, the more often your brain attends to your pain from a sense of curiosity and safety versus fight or I got to get out of it, right? Flee, if you will. The more the pain experience behavior loses its purpose. And before long, it extinguishes itself. So here you go. So if you positive input with the brain, wait, hurt doesn't equal harm. I don't have to be afraid to move. That's not damaging me. Awesome. It's safe to move. Cool. Move more, less fear, pain. Movement doesn't hurt. Get it going that way. It's another way to do it, right? You might be wondering, how do I even do this? How can I recognize the pain I'm experiencing, not want to run from it, not let it frustrate, worry, or concern me? Step one is mindfulness. The first thing you need to do is become mindful of the fact these thoughts and this cycle is occurring in the first place. So many people, it's like, they jump onto this bandwagon. They don't even, their mind just churns out endless stories, right? And fear and concern and worries. And it's constantly just attending to it. And it's something that just becomes natural and learned over time, right? So the next time you begin to experience symptoms, tune into your body, assess what's happening, become aware of any negative thoughts, beliefs, associations, stories that come up for you. If the pain becomes too bad, right, freaks you out, no worries, just get out of it. This too shall pass, right? Otherwise, don't try to control it or get rid of it for once. It is what it is. It's an unpleasant and unwanted sensation. Just notice what you're feeling and experiencing. Where is it? What is it doing? And it's likely to notice your mind begin to churn out, again, thought after thought, question after question as it relates to your pain. Why is this happening in me? I hope this doesn't get as bad as it did last week. I've been doing all my exercise. Why am I still in pain? Just catch these thoughts and let them pass. Remember, pain is not the issue. It's the thoughts, stories, and beliefs that it carries with it. Like a rabbit chasing a carrot, right? When things get bad, do you chase the carrot and let your mind wander? Or do you hold your ground and casually observe it, right? So you have a bad day, right? Then you're like, oh, this doesn't work. If you have a good day, then you're confident, you're hopeful. And then the next day it's a bad day, right? And you just keep going, you keep riding the roller coaster. You've got to find some consistency there, some way to detach from the symptoms and just say, hey, I'm going to do the best I can here, right? I'm going to become mindful first off, just simple way to get into the process. I'm going to become mindful of the sensations of the experience that is being created as I come in contact with this, unpleasant sensation, which is basically a danger signal, pain. All right. So, this is easier said than done. Breaking the cycle is tough work, sort of like breaking, a habit. It doesn't happen overnight, but with persistence, it can be. Okay. So hopefully you got something out of this, right? Now you might be thinking, well, what do I do? This is what you do, right? You start becoming mindful of this, and maybe you are just by watching this video. But the idea is that I hope that this cascades sort of this thought that, hey, just something as simple as this, wait, hurt doesn't equal harm, can often free people of these negative beliefs, right? And this belief that something's broken and therefore they need fixing. And they continue down the rabbit hole of trying to figure out what it is and then doing this, doing that. And at the end of the day, when it doesn't result in things, what happens? When it doesn't result in improvement, they get frustrated. And then this didn't work again, right? And it just feeds this catastrophization loop. right? Of hypervigilance to solve the problem. This is very common, by the way, that people who are type A students, valedictorians, top 10% of their class, really career oriented, right? Have goals, have plans in life, get her done type people. This is me, by the way. All right. We'll get stuck in this loop because they're very hypervigilant. They're on high alert with everything they do. And it serves you well in life. It serves them, I'm talking to people in general, well in life, but it might not serve you well when you're trying to get out of pain because you're trying to, wrestle it down like a squirrel, right? Or I saw a TV show the other day. There was a fish that was flopping around. This person was going crazy, right? Trying to catch his wet fish, right? All over the place. Creates a lot of muddiness in the water. And the idea is that the more you try to control this thing, this entity, right, which is an experience of the mind and the body, the more it can kick back on you. And the more you prove to that thing what you're trying to get rid of, that it's a problem that needs to be gone. All right. So just a different angle, right? Just a little mindset shift, not an exercise, really, not a new way to sit or sleep or anything like that. Just a little bit of a mind shift for you if you're dealing with this problem. And hopefully this can be a catalyst for you to start to think differently. And, you don't even need to be hopeful because, again, so many people in pain, they've tried so many different things. I'm not saying, hey, be hopeful that this approach will work, but I'm just saying be open to it, right? And be willing to explore a new way of looking at things because if you're watching this, the way that you've been doing it has probably not been working all that well. Okay, so hopefully this is helpful. Again, my name is Dr. Charlie Johnson. Like, comment, subscribe below for more like videos. This is my specialty. Again, I help people with chronic back, butt, and sciatica problems. Get over it. Teach them strategies, movement and mindset-based strategies to get control of their life and get back to living life as normally as possible. So that being said, we will chat soon, everyone. Again, like, comment, subscribe below. Thanks for watching.